Thank you. Do I hear a motion to dispense with the calling of the roll?
Chair, maybe dispense the calling of the roll.
There's a duly seconded motion that we dispense with the calling of the roll. Hearing no objection, the same is approved. Do I hear a motion to dispense
Mr.
with
Chair.
the reading? Yes, the Honorable Rehencia.
I move to dispense the reading of the minutes of the previous meeting and approve the same.
There's a duly seconded motion that we dispense the reading of the minutes of the previous meeting and the adoption of the same. Hearing no objection, the same is approved. At this point, we'd like to recognize the members who are here present this morning. Honorable Celso Rehencia of the Lone District of the City of Iligan. Our Vice Chair, Honorable Marlesa Doc Marley Hoofer Hasim of the 2nd District of Zamboanga, Sibugay. Honorable Antolin A. Oreta III of the Lone District of the City of Malabon. Honorable Francisco Lalo T. Matugas of the 1st District, Surigao del Norte. Honorable Keith Micah, Attorney Mike Tan of the 4th District of Quezon. And Honorable Eleanor C. Bulut Begtang of the Lone District of Apayao. Thank you. Comsec, can you acknowledge our resource persons this morning?
Thank you, sir. Good morning to all. We'd like to acknowledge our guests present today. From the Department of Health, we have Ms. Andrea Orachea from the Health Promotion Bureau, Mr. Jose Carlos C. from the Health Facilities and Services Regulatory Bureau. Coming is Director Melissa Sena from the Health Facility Development Bureau. From the PhilHealth, we have Dr. Kyrene Tupil, Medical Specialist. From the Securities and Exchange Commission, or SEC, Attorney Abigail Shakina Tria, Office of the General Counsel. We have with us from the Department of Trade and Industry, Mr. Marvin Tandayo. From the Association of HMOs of the Philippines, Mr. Carlos De Silva, Executive Director. We also have from the Philippine Association of HMO Companies, Attorney Andrew Patrick Fournier and Dr. Leia Yolo. From the Conner District Hospital in the province of Apaya, we have the Administrative Officer, Ms. Jennifer Kengay. And from the Far North Luzon General Hospital and Training Center, Dr. Nelson Rigor, Medical Center Chief. That's all, Mr. Chair.
Thank you, Comsec. Before I proceed with the opening remarks, I'd like to acknowledge the presence of Honorable Maximo Dalog of the Lone District of Mountain Province. Good morning, distinguished members of the committee and our esteemed guests. Welcome to the 5th meeting of the Committee on Health. I would like to thank the honorable members who are in attendance today for giving your valuable time. In the agenda of the committee meeting today are 5 bills of local application which seeks to establish, renationalize, and rename government hospitals. We also have in our agenda 7 national bills as follows. 2 bills on the regulation of the health maintenance organizations, 3 bills on protecting Filipinos from harmful effects of trans fatty acids, and 2 bills on strengthening the regulation of the health facilities and services, repealing for the purpose the Hospital Licensure Act. Please note that the bills on HMO, the trans fatty acids, and the hospital licensures were approved by the Committee on Health on the 19th Congress. However, it was referred to the Committee on Appropriation and the Ways and Means, awaiting action, but it was overtaken by the 20th Congress. As such, the bills referred to the committee this 20th Congress on the same subject support the same version as approved by the committee in the 19th Congress. So we now proceed with deliberation of the bills regulating the health maintenance organization. Before we recognize Honorable Matugas, we'd like to acknowledge the presence of our member, Honorable Edwin Cruzado, Dr. Edwin Cruzado of the 1st District of Cotabato, and Honorable Jose Manuel Floriendo Lagdameo of the 2nd District of Davao del Norte. Thank you. So we now call on Honorable Francisco Matugas to sponsor House Bill number 2992, entitled An Act Ensuring the Access of All Filipinos to the Highest Attainable Standard of Health and Improving Health Financing Security of All Filipinos through health maintenance organizations, regulating their operations by establishing a Center for Managed Care Services. Oh, sorry. This is, no. Sorry. Let's, sorry. Let's tackle House Bill number 2992, entitled An Act Ensuring the Access of All Filipinos to the Highest Attainable Standard of Health and Improving Health Financing Security of All Filipinos through health maintenance organizations, regulating their operations by establishing a Center for Managed Care Services, appropriating funds therefore and for other purposes, by Honorable Antolin Oreta III. Honorable Oreta is now recognized.
Thank you, Mr. Chair. Good morning to you, to my colleagues, to all the resource people here. Actually, I'll just have the explanatory note serve as my sponsorship speech, Mr. Chair. Thank you.
Thank you, Honorable Oreta. We now call on Honorable Francisco Matugas for House Bill number 5506, entitled An Act Ensuring the Access of All Filipinos to the Highest Attainable Standard of Health and Improving Health Financing Security of All Filipinos through health maintenance organizations, regulating their operations by establishing a Center for Managed Care Services and appropriating funds therefore and for other purposes. Honorable Matugas is now recognized.
Thank you, Mr. Chairman. I'd like to acknowledge our members of the committee, our guests, ladies and gentlemen, good morning. It is my honor to sponsor the Health Maintenance Organization Act of 2025, a long overdue measure that finally provides a clear and appropriate legal framework for Health Maintenance Organization, or HMO. For over 40 years, HMO has been a vital part of our health system, giving millions of Filipinos access to primary care, prevention, and affordable health coverage. Yet they continue to operate under outdated executive order without a proper law to guide, protect, and strengthen the role. This bill closes that gap. It recognizes that HMO are not insurers but health management institutions that coordinate care, manage provider networks, and promote preventive health. Unfortunately, they are still regulated as insurance companies, creating inefficiencies, higher costs, and confusion for consumers. To fix this, the bill establishes the Center for Managed Care Services, a dedicated regulator with both financial and health expertise, tasked with protecting consumers, enforcing standards, and ensuring coordination with the Department of Health. This reform directly supports the Universal Health Care Act by 1. Strengthening financial risk protection for Filipino families, 2. Promoting preventive and primary care, 3. Aligning service quality and care coordination, and 4. Expanding safe complementary private coverage. Every year we delay this reform, we leave millions of members, employers, and providers in uncertainty, and we weaken a system that could be a strong partner in achieving universal health care. The Health Maintenance Organization Act of 2025 replaces outdated rules with clarity, fairness, and accountability. It protects consumers, modernizes managed care, and reinforces the very goals of universal health care. Honorable members, Mr. Chair, I respectfully ask for your immediate and favorable approval of this measure. Let us create a regulatory framework that truly reflects today's healthcare realities, one that protects people, promotes prevention, and supports a healthier Philippines. Maraming salamat po. Thank you, Mr. Chair.
Thank you very much, Honorable Matugas. Before we proceed, we'd like to acknowledge the presence of our committee member, Honorable Henry Waminal Jr. of Asenso Pinoy Party List. Thank you. We now call on Mr. Mike Bulatao of the Department of Health. I would like to appeal to our resource person to make your presentation brief in the interest of time. Thank you.
Thank you, Mr. Chair. With regards to the proposed bill, the Department of Health manifests its support for the proposed measure consistent with the position we conveyed for a similar bill filed in the previous Congress. We recognize the intent of this legislation and affirm our commitment to work collaboratively with Congress in advancing policies that promote the health and well-being of all Filipinos. In line with our standard internal process, the department will submit an official and comprehensive position paper once the Secretary of Health has reviewed and signed our position paper po. Thank you very much.
Thank you very much. From PhilHealth, Dr. Kyrene Tupil. While waiting for her, we now call on Attorney Abigail Tria of the Securities and Exchange. From the Securities and Exchange Commission.
Yes, Mr. Chair. Good morning po. We thank the committee for the opportunity to provide comments on the proposed House bills. And the Commission supports the bill's objectives, especially the establishment of a regulatory framework aimed at safeguarding patients' rights and ensuring access to quality health services, Mr. Chair. However, a reading of the bills indicates that the matters involved are well within the jurisdiction and expertise of the the DOH, PhilHealth, and Insurance Commission, so we will have to defer to their comments and position on the matter, Mr. Chair. But at this point, we do not have any objections, and we will just submit our official position paper, Mr. Chair. Thank you po.
Thank you. From the Association of Health Maintenance Organization, Mr. Carlos De Silva.
Thank you, Your Honor. Magandang araw sa inyong lahat. For the longest time, the HMO industry has and continues to be an integral part of the country's health delivery systems. So we thank both Honorable Oreta and Honorable Matugas for sponsoring these bills. Now, on House Bill 2992 by the Honorable Antolin Oreta and House Bill 5506 by the Honorable Matugas, we agree to the following key provisions in both bills. Number one, cost of HMO membership fees will be tax deductible from taxable income of employers. Number two, HMOs will be VAT exempt. Number three, the creation of a Center for Managed Care Services under the Department of Finance to regulate the HMO industry, headed by an administrator and 3 deputy administrators for legal services, health services, and financial management, respectively. And the fourth one, HMOs to be exempt from anti-money laundering compliance but will continue to report suspicious transactions involving large or unusual financial activities to the appropriate authorities as mandated by relevant laws and regulations. However, we have some reservations to the proposed minimum paid-up capital of 200 million for all HMOs. And we are going to be glad to discuss this with your technical committee soon so that we could come to an agreement on the issues. Thank you.
Thank you, Mr. Carlos da Silva. From the Philippine Association of Health Maintenance Organization, Dr. Leia Yolo.
Good morning, Honorable Chairperson, Honorable Shiriako Gato, distinguished members of the Committee on Health, colleagues in public service, and fellow advocates for Filipino health. I am Dr. Leia Yolo, a practicing physician and the President and Medical Director of the Philippine Association of Health Maintenance Organization Companies, representing a majority of HMO companies in the Philippines, and it is my honor to express our full and unequivocal support for the passage of the Health Maintenance Organization Act of 2025. I speak today not only as an executive of the healthcare organization, but also, more importantly, as a doctor, as someone who has seen firsthand how lives can be changed, extended, or lost depending on the structure and accessibility of our healthcare system. I also speak to you today as someone who has stood in this very Congress in the previous legislative cycle. I was here when similar measures were deliberated. I raised the same concerns, the same realities, and the same urgent call that the Philippines must adopt a proper, coherent, and medically grounded framework for HMO regulation. And I stand here today with the same conviction, strengthened, not diminished, because the urgency has only intensified. The problems we identified years ago have not disappeared. They have grown, and the need for this reform has never been clearer. Every patient who enters a clinic or hospitals brings with them two diagnoses, a medical diagnosis and a financial diagnosis. In practice, the second diagnosis often determines the outcome more than the first. The passage of the 2025 HMO bill directly addresses this reality. It strengthens the role of HMOs as organized systems for prevention, continuity of care, and cost management, all essential for ensuring that our patients are not delayed or avoid treatment simply because they cannot afford it. As doctors, we see the human cost of fragmented, uncoordinated, and inaccessible care. We know that timely intervention saves lives, and that delayed care because of financial barriers worsens outcomes, increases complications, and ultimately burdens both family and the healthcare system. This bill strengthens one of the most effective mechanisms available today to bridge the financial gap between the patient and the healthcare they need. The Philippines has embarked on a bold path through the Universal Healthcare Law, and yet, honorable members, no health system in the world, whether in Europe, Asia, or the Americas, achieves universal healthcare through government alone. Every successful UHC model relies on a balanced partnership between government health financing, public and private providers, and private health financing mechanisms such as HMOs. The HMOs, when properly regulated, expand the reach of UHC by first providing preventive and primary care, reducing catastrophic health expenditures, relieving congestion in public hospitals, offering structured care pathways, coordinating across networks of providers, ensuring continuity of care outside PhilHealth benefits. Simply put, UHC needs HMOs, and HMOs need a clear and appropriate legal framework to play their role effectively. This bill provides that framework. As a physician, I must emphasize a critical point. HMOs are not insurance companies. HMOs are not hospitals. We are a hybrid health system partner providing managed health financing and managed health delivery. This dual function allows HMOs for monitor patient compliance, promote preventive medicine, manage chronic diseases, ensure quality through accredited providers, coordinate care among specialists, prevent unnecessary procedures, and ensure that the patients receive the right care at the right time. That is why the Supreme Court has already recognized that HMO agreements are service contracts, not insurance contracts. This bill finally aligns the law with medical reality. Today, HMO falls under the Insurance Commission, a regulatory whose expertise is financial risk, not clinical quality. From a medical standpoint, this is problematic. HMOs need oversight that understands appropriate medical utilization, clinical review standards, quality assurance, care coordination, provider accreditation, preventive health outcomes, chronic disease pathways, and the difference between necessary care and unnecessary costs. This bill creates the Center for Managed Care Services, a regulatory designed to integrate financial soundness, medical oversight, patient protection, and quality of care benchmarking. This is not only good governance, this is good medicine. A common misconception is that HMOs duplicate PhilHealth. They do not. In reality, HMOs fill the gaps that PhilHealth cannot cover, address outpatient and preventive care, provide quicker and more predictable access, support private hospitals in offering competitive rates, reduce out-of-pocket expenses beyond PhilHealth ceilings, serve as a first line of health financing for many working Filipinos. UHC is strengthened, not threatened, by the presence of well-regulated HMOs. We cannot implement UHC effectively without leveraging the capacity, efficiency, and preventive focus of the HMO system. This bill makes that partnership possible. Honorable members, I have personally treated patients who had a delayed checkup because they feared the cost, refused admission because they had no insurance, opted out of medication because they could not afford it, died in silence because financial burdens stopped them from seeking help. These bills brings us closer to preventing these tragedies. Our regulated, well-integrated, and clearly governed HMO sector is not only a structural reform, it is a life-saving reform. I stood before this Congress in the previous term. I raised these issues again today, and until this bill becomes law, I will continue to raise them because the stakes are measured in lives and statistics. I stand before you today not only as an HMO president, but as a physician who has sworn to protect life. For these reasons, I respectfully urge the committee to grant its full and immediate support for this measure. Together, let us build a system where no Filipino delays care, avoids care, or fears care because of cost. Maraming salamat po.
Thank you very much, Dr. Yolo. Before we proceed, we would like to acknowledge the presence of our Vice Chair, Honorable Walfredo Arman de Maguila Jr. of the Lone District of Biñan City, Honorable Kenneth Paulo Tereng of KM Ngayuna Party List, and Honorable Chino Miguel Almario of the 2nd District of Davao Oriental. Thank you. We now call on Dr. Kyrene Tupil of PhilHealth.
Good morning, everyone. I am here to represent PhilHealth, specifically PhilHealth Plus. So regarding the proposed bills on regulation of HMOs and its interoperability with PhilHealth, we are PhilHealth Plus is able to release an advisory that specifies that premiums paid to the HMO should be discounted based on assumed PhilHealth payments. So we recognize that PhilHealth has continually expanding benefits and that we are currently have limited benefits on specialist outpatient care, non-PNF drugs, and the annual physical examination, which may be covered by our HMOs and is aligned with the complementation that is stated in the Universal Healthcare Act. That would be all po. Thank you.
Thank you.
Mr. Chair,
Honorable Tereng.
I move for the consolidation and approval of House Bills number 2992 and House Bill number 5506.
There's a duly seconded motion to consolidate House Bill number 5506 and House Bill number 2992, taking into account the position of our different resource person this morning. Any objection? Hearing none, the same is approved. We now proceed to the deliberation of bills strengthening the regulation of health facilities and services. Sino magkano? Sino mag? Wala. Meron ba magkano? Hindi ka sir, wala eh. Sino bang? One minute suspension. Meeting resumes. We now tackle House Bill number 2428, an act strengthening the regulation of health facilities and services, repealing for the purpose Republic Act number 4226, otherwise known as the Hospital Licensure Act, and appropriating funds therefore by Honorable Linabel Ruth Villarica. In behalf of Honorable Villarica, we now recognize Honorable Almario.
Thank you, Mr. Chair. Good morning to all the members present and to our guest persons also in attendance. It is my honor to sponsor House Bill number 2428 on behalf of Honorable Linabel Ruth R. Villarica. And I would like to also move that the explanatory note be passed as the sponsorship speech, Mr. Chair.
Thank you very much. For House Bill number 5506, 559, an act strengthening the regulation of health facilities and services, repealing for the purpose Republic Act number 4226, otherwise known as the Hospital Licensure Act, and appropriating funds therefore. We now recognize Honorable Keith Micah, Attorney Mike Tan, for his sponsorship speech.
Thank you, Mr. Chair. Good morning po sa ating lahat. This proposed measure introduces a shift from the traditional way of regulation by regulating the industry as opposed to mere regulation of individual and specific health facilities. As such, there will be fewer opportunities for circumvention and health costs becomes controlled. Additionally, the quality of health facilities and services will improve as well as the competitiveness, efficiency, and productivity of the industry. The measure provides us for the upgrading of the critical technical guidelines and infrastructure to enable the DOH to cope with the challenges of globalization. Thus, aside from competitiveness, the high quality of health facilities and services are ensured. The creation and management of a benchmarking system will also improve quality and efficiency in health regulation and ensure accessibility with respect to necessary health facilities, especially to the poor. By regulating the costs of health services in health facilities, especially through strengthened Bureau of Health Facilities and Services, these services will be made more accessible financially to the population, especially those who belong to the lowest income group. For our speedy deliberation, may I request that the committee to adopt the explanatory note of House Bill number 5559 as my sponsorship speech. However, let me stress the importance of passing this legislative measure. For that, Mr. Chairman, Your Honors, may I request the committee to also adopt and may I request for your support for the expeditious approval of this measure. Thank you po.
Thank you very much. We now call on Mr. Jose Carlos C. of the HFSRB, DOH.
Good morning, Mr. Chair. On behalf of our Director Engineer Annette Bitan, our Director 4 of the Health Facilities and Services Regulatory Bureau, we would like to express our support for the proposed bills, House Bills number 2428 and House Bill number 5559. Mr. Chair, may I be allowed to share a little bit of a background on our proposed bill? Versions of the proposed Health Facilities and Services Regulation Bill have been consecutively filed since the 13th Congress. Yet these versions have not been approved, nor has it been enacted as a law. There are now current various trends and improvements in the field of healthcare which have led to the emergence and development of new types of healthcare facilities, which were not contemplated from our original charter, which is the Hospital Licensure Act, Republic Act number 4226, which was enacted last 1965. Presently, there are emerging types of health facilities such as diagnostic, therapeutic, and rehabilitative centers, unlike before when there were only hospitals and clinics that are not yet being regulated by the Department of Health. Diagnostic, therapeutic, and rehabilitative centers and other hospitals were beyond the regulatory ambit of the Hospital Licensure Act. Thus, through the proposed bills, we hope that a new regulatory framework will also cover these facilities. The passage of these bills will greatly expand the regulatory lens of the Bureau in ensuring safe and quality health facilities across the healthcare continuum. We need this proposed measure to introduce a shift from the traditional way of regulation of individual and specific health facilities into an agile, risk-based, and risk-informed regulation. Diagnostic, therapeutic, and rehabilitative centers and other health facilities will now be covered under this new regulatory framework. Hence, the existing law needs to be amended to strengthen our regulatory powers and in line with our mandate to ensure high-quality health facilities and services for all Filipinos. With all, the Department of Health will officially submit its position paper once it is signed by the Secretary of Health. Thank you very much, Mr. Chair.
Thank you. Please submit your position paper to this committee. Any member of the committee? Honorable Almario.
Mr. Chair, I move to consolidate measures including House Bill 2428, 5559 in the committee report, Mr. Chair, as do so move.
Second.
There's a duly seconded motion that we consolidate House Bill number 2428 and 5559, subject to style and amendment. Is there any objection? Hearing none, the same is approved. Before we proceed, we'd like to acknowledge our committee member, Honorable Maria Victoria Copilar of the 6th District of Quezon City. Next is on the bill strengthening the bills on bills protecting Filipinos from harmful effects of trans fatty acids. For the sponsorship speech, we now recognize Honorable Attorney Mike Tan for House Bill number 1477, House Bill number 5455, and House Bill number 6098. Honorable Tan.
Thank you, Mr. Chair. On behalf of Honorable Remulla and Honorable Degamo, I move that their explanatory note be adopted as their sponsorship speech. As for my sponsorship speech for House Bill number 5455, Your Honors, I would just like to emphasize the high intake of trans fatty acids increases the risk of death by any cause by 34%, and CHD mortality and morbidity by as much as 23% and 28% respectively. Every year, more than 500,000 deaths are attributed to TFA globally. Dubbed as the tobacco of nutrition, TFA has no health benefits and is completely replaceable with no difference in taste of cost of food. According to the World Health Organization, TFA elimination is considered as one of the simplest and most straightforward public health interventions to reduce the risk of cardiovascular diseases and improve nutritional quality of diets. As more countries regulate TFA, countries without regulations become vulnerable to dumping of TFA-rich imported food. Now more than ever, the need for preventive health care and healthy lifestyle promotion must be realized in line with the vision of universal health care. Having said that, Mr. Chairman, Your Honors, I am also counting on your support for the expeditious approval of these bills. Thank you po.
Thank you, Honorable Tan. We now call on Ms. Andrea Orechea of the Health Promotion Bureau of the Department of Health.
Thank you, Mr. Chair, Your Honors. On behalf of Directors Maria Cristina Marasigan and Dominic Madumba of the DOH Health Promotion Bureau, allow me to read our position statement. The Department of Health supports the intent of the proposed bills, House Bill numbers 1147 and 5455, or the Trans Fat Free Philippines Act, seeking to protect the Filipino people from the harmful effects of trans fatty acids. This is a proven and cost-effective public health intervention that puts forth health promotion and preventive care to reduce the national burden of non-communicable diseases. In their 2022 Non-Communicable Diseases Progress Report, the World Health Organization estimated that 70% of all deaths in the Philippines are due to non-communicable diseases, 25% probability of premature mortality. Likewise, the 2021 Global Burden of Disease identifies unhealthy diet as one of the leading causes of preventable deaths globally and major drivers for non-communicable diseases. Trans fatty acids, or TFA, elevate low-density lipoprotein while lowering high-density lipoprotein, which increases the risk of CVDs and diet-related non-communicable diseases. High TFA intake increased the risk of death from any cause by 34%, coronary heart disease death by 28%, and coronary heart disease by 21%. Evidence underscores the urgent need for a strengthened legislative framework to support the successful elimination of TFAs from the Philippine food supply. The DOH supports the enactment of this bill as it seeks to address gaps in current regulatory enforcement and reinforces the national policy on the elimination of TFAs for the prevention and control of NCDs. Mr. Chair, the DOH will submit our official position paper upon approval and signature of the Secretary of Health. Thank you.
Thank you. From the Department of Trade and Industry, Mr. Marvin Tandayo.
Good morning, Your Honors. The Department of Trade and Industry supports the policy objective of the House Bills 5455 and 1477, which seeks to protect consumers from the harmful effects of industrially produced trans fatty acids, or FTAs. From a trade and industry perspective, these bills offer the opportunity to enhance consumer protection, promote health markets, and improve competitiveness of the Filipino food manufacturers, both domestically and internationally. DTI therefore expresses its general support for the legislation, while we propose refinements to ensure smooth implementation, fairness to MSMEs, and policy coherence with existing standards and regulatory frameworks. We also defer to the comments and suggestions of the appropriate agencies as to the technicalities of the bills. We shall then send a comprehensive position papers on the bills, Your Honor. Thank you.
Thank you very much, Mr. Tandayo. From the Department of Interior and Local Government, Mr. Paulo Florentino.
Good morning, Mr. Chair and Your Honors. The Department of the Interior and Local Government has yet to submit its position paper on the proposed House Bills number 5455 and number 1477. But as to iterate our general position on the matter, the Department expresses its strong support therefore. We recognize that the right to health is a fundamental mandate of the states. Thus, the proposed bills provide a sound legislative framework to eliminate industrially produced trans fat from our local food supply, thereby preventing thousands of deaths each year from non-communicable diseases. Verily, we welcome the proposed inclusion of the department as a member of the interagency task force led by the DOH, as it helps us ensure that LGUs are capacitated and accountable for delivering devolved health functions in the locality. Hence, we recommend for strong capacity building programs and educational awareness or campaigns for the LGUs with the help of the relevant agencies concerned and the clear specific role or roles of the department in line with its statutory mandate of general supervision over LGUs. But this is best addressed during the TWD or in the subsequent drafting of the IRR. Again, from the viewpoint of the department, we stand ready and committed to fulfill our coordinative roles proposed upon us before the LGUs to protect the health of the locals, regulate market and food establishments, enforce sanitation and food safety standards and disease prevention programs, and diminish or eliminate more resources drained from our already overburdened health systems. Rest assured of the ILG's continued commitment to advancing health safety and general welfare at the local level. That's all. Thank you, Mr. Chair.
Thank you, Mr. Florentino. Please submit your position paper to this committee. Any member of the committee? Yes, Honorable Dimagilang.
Mr. Chair, I move for the consolidation of the three bills, subject to style.
Second.
There's a duly seconded motion to consolidate the two bills, subject to style and amendment. Oh, three bills. Subject to style and amendment. Any objection? Hearing none, the same is approved. At this point, we'd like to excuse the resource person for the bills on trans fatty acids. We now proceed with the deliberation of our local bills. House Bill number 395, an act entitled Reverting to the National Government the Discharge of Basic Health Services of the Davao Oriental Provincial Medical Center and appropriating funds therefore, by Honorable Representative Chino Miguel Almario. Honorable Almario is now recognized.
Thank you, Mr. Chair. And again, good morning to all of our members present and to our guests also present and in attendance. Mr. Chair, in the previous Congress, this representation, if you remember, along with the late Governor Cora Malaniaon, we were both present in the committee to submit and to proudly sponsor House Bill then number 5952. And that aims to renationalize the Davao Oriental Provincial Medical Center, or DOPMC. And during the deliberations of the said bill, the members of this esteemed committee were made aware of the fiscal challenges that were brought upon by the prioritizations of the local government. As of now, the national tax allocation of the province of Davao Oriental is only enough. But the thing is that since the hospital is also funded locally by the province, it also shares a bit of that financial burden. Before, during the pandemic, the allocation of the Davao Oriental Provincial Medical Center was reduced to nearly $500 million. And that was because the province had to also prioritize the constituents in different matters. Davao Oriental is riddled with many challenges, such as disasters, as what was known also during the recent 7.4 and 6.9 magnitude earthquakes. And it also faces problems also with insurgency. And so the prioritization of the entire province may be halved to different priorities. And one of which that is greatly affected is the funding of the provincial hospital. To put it into perspective, Mr. Chair, the lesser budget of the hospital leads to inadequate equipment, then therefore leads to also the lack of funding for equipment operators, and therefore reduces the quality of facilities. When we visited during the last Doblet earthquake, all of the patients were put outside because they had ongoing checks, but the actual situation was far worse than we imagined. They had to resort to using portalets. They had to also stay inside tents with ventilation systems that were being borrowed from different municipalities. And it also showed that it is difficult for DOPMC to function only using barely just the province's resources. Another situation, Mr. Chair, is that even the quality of service itself is also down. Because of the lesser budget, they have financial burdens with hiring qualified, able, and good medical practitioners. And so therefore, instead of being able to hire more, they have lesser people, and the quality of service then goes down. I'd like to also put on record an example that one of the biggest challenges of DOPMC is its birthing stations. In fact, it is very common to the people of Davao Oriental that if you give birth in Davao Oriental Provincial Medical Center, ikaw pa mismo yung nagle-labor, ikaw pa mismo yung pinapagalitan ng nurse. So it is very difficult, Mr. Chair, and I hope that in this Congress, we get a stronger hold on the passage of this bill, Mr. Chair. Last Congress, it was passed in this committee, but it wasn't tackled during the Committee on Appropriations. And so with that, Mr. Chair, I strongly ask for the support of these members, and also, I guess, with the passing also of this, with the transmitting of this bill to the Committee on Appropriations, that this finally be passed during this Congress, Mr. Chair. Daghang salamat sa inyong tanan.
Thank you, Honorable Almario.